essentially we'd be taking full control of both sectors from a financing point of view. No real talk around how the fundamentals of governance and management of facilities will change.
What risk does the proposed national health insurance policy pose to South Africa's healthcare system? I posed this question to Mike Settas of the Free Market Foundation in a recent episode of my podcast. What follows is a short extract from a longer conversation. You can watch the full-length discussion by clicking on the link in the description below. Enjoy. Those of my audience who are not familiar with national health insurance and the proposal that's been on the table for many years now, what is it exactly? What is being proposed by the Department of Health and the government more broadly? And what are some of the issues that you are flagging?
Yeah, so and it certainly has been on the table for a long time. We're looking at next year will be the 14th year in which this has now been official policy. But the key issues are that it's an exceptionally high-risk proposal. And what it's proposing is to simultaneously amalgamate the public and private health systems into one state-run health system. You know, the concerns that we have around it and in the policy process is that technical feasibility analysis has been pretty much absent. There's no costing analysis on it. I heard recently that, in the Health Portfolio Committee that the DA is calling for a financial feasibility study from Treasury and from the Finance Minister to say, how are we supposed to even evaluate this bill, which is now before Parliament, if we have no idea what it's going to cost. So those are some of the concerns. I think they're major concerns, especially with such a massive, far-reaching proposal. But there doesn't seem to be much in the way of addressing those concerns. My sense is that the policy has been driven very much on ideology of just central control of everything. For the private sector, they can pretty much view this as a nationalization of the private sector into the state-run entity, the NHI fund.
All right, so basically this is centralization of all healthcare financing. And I think for the purposes of this conversation, we can distinguish between the funding side and then the operational side of our public healthcare system and also the private healthcare system. But obviously the two will be very much interrelated.
It has fundamentally all been about the funding. The focus of the NHI is not focused on the operational aspects of how to work or whether to address some of the fundamental and substantial problems that exist in the public sector in terms of governance frameworks, in terms of management capabilities, substantial failures that exist. The NHI proposal is really focused only about funding, and with this overarching, I wouldn't maybe call it an ideology, but a sort of belief that if you just throw more money at this thing, it's, we're magically going to fix all the problems in the public health system. So the way the NHI is proposing is that the private and public sectors will coexist, but they'll all be under the control of the NHI fund. So the NHI fund will determine for members of the NHI which doctor you'll go to. So if you're close to this doctor and it happens to be a private doctor, you go there. But if you happen to be close to this one and and it's a public doctor, you go there. So essentially we'd be taking full control of both sectors from a financing point of view. No real talk around how the fundamentals of governance and management of facilities will change.
All right. And anybody who's spent any time in a public hospital will know that it's in quite a dire state. I mean, compared to the rest of sub-Saharan Africa, we actually have quite a well-endowed public healthcare system. But there are numerous perverse incentives in that system, a lot of inefficiencies, a lot of governance problems, and a lack of accountability that has really seen the deterioration of those services. So I mean, it seems to me that this big kind of mega financing plan that's going to essentially crowd out private healthcare funders is not really going to address those key concerns and might actually make them even worse in the public healthcare system.
Yeah, I think it would be hard to believe it could get worse, but I think it could. It would. But yeah, it will definitely crowd out the private funding sector in terms of the NHI taking over all the funding. So it'll be anything that the NHI covers, the medical schemes will not be allowed to insure that service or that benefit. So that is definitely a fundamental of what the proposal is.
Nicholas Crisp, the Deputy Director General in the Health Department, he's saying that both the public and the private sector have issues. I mean, do you think that he is fairly representing the state of healthcare in South Africa?
I think he's absolutely correct that both sectors have problems. The private sector has the fundamental problem the private sector has is cost and inefficiency around that. But to draw an equivalence between them, I think, is an exceptionally large leap or stretch to try and make. By and large, the private sector still functions well in terms of its delivery of care. The quality is high. Waiting periods for any sort of major procedures are pretty much unheard of. People who get major illnesses will access treatment very quickly. Its problem, as I say, is cost, but it still functions. It's still working well. But there are areas in which it can be fixed. And I think the importance of that is that the country has already been given a blueprint for that and has actually paid for it through the health market inquiry, which was run by the Competition Commission over a period of 6 years, which was characterized by an enormous amount of data collection, research, and engagement with stakeholders in terms of what they see the problems are, what could be the solutions to those. And there's a blueprint now, and it sits there in the final conclusions, recommendations of the health market inquiry, but we see absolutely no appetite to engage that and actually implement any of those, because everything's being done in favor of NHI, which is an overarching proposal for both public and private.
All right, so let's look now at some of the mechanics and where we are in terms of the legislation. We have the NHI bill that's before Parliament that's likely to be passed. Do you know anything about timelines there?
I know that the Portfolio Committee is now finished going through the bill clause by clause. And now the position is that there are 12, I think it's 12, there might be 13, but let's call it just 12 for now. 12 other statutes or other acts which are required to change in order to support the NHI bill, or once it becomes the act, NHI Act as such. But that process is an amendment. Each one of those, each one of the 12 is now an amendment to an act, which we believe would have to go through the same parliamentary process with public consultation and engagement that any other act or amendment to an act would have to go. So that's quite a task for that Portfolio Committee to go through that. We haven't seen the meat of those changes either. It's been spoken as to what, in principle, the changes are required, but the meat of it and the details is still not there. So it seems to me that the sort of ambitions of this NHI bill being passed anytime soon is rather ambitious, given that there are at least 12 other pieces of legislation, not regulations. These are acts that need changing in order to support the NHI bill before the NHI bill could become an act. So quite a substantial amount of work.
Okay, but in some respects, that's an opportunity to throw some sand in the gears and slow down the implementation of NHI.
Yeah, well, yes. I mean, it's the point is as well is that a lot of the meat of how things will work lies in that other legislation. So again, the NHI bill has put together a very, very broad framework. It doesn't really get into much detail in any particular area. And the meat of it is really, lies in how it relates to these other pieces of legislation. So, but it is, absolutely, I agree. It certainly is an opportunity for us to call into question the fact that those other pieces of legislation were not considered in, together with the NHI bill as a solution. This is what we're proposing in these pieces of legislation. Along with what's in the NHI bill, because you can't really see the full picture without those other pieces of legislation and what those proposed changes are.
Thanks for watching. If you enjoyed this analysis, you might want to watch the full-length interview with Mike Settas. That's linked over here. You can also subscribe to my other channel for more longer conversations. That's linked over here. My name is David Ansara. Until next time, take care.